Hello, my name is Nathaniel Burmeister. I'm doing my head-to-toe assessment video with my patient here. I'm going to get started. Can you just start by saying your name and age?
I'm Burmeister, and I am 27.
Okay. So, in general, just first glance of the patient's general state, the patient appears to be in good nutritional health for her height and body to weight ratio. The patient is exhibiting good posture. The patient has properly aligned body positioning, no deformities or abnormalities noted. The patient's mood seems to be appropriate, affect seems to be appropriate. I'm looking her right in the eye. Speech seems to be in line with her cognitive abilities and appropriate for her age. No abnormalities with hygiene noted. So from there, I'm going to go to a skin assessment. The patient has on long sleeves, so I guess we're going to have to pull her sleeves up here and just go through the motions of it. Really, there's no bruising noted with the patient's skin in the upper or lower extremities or in general. So skin seems to be overall intact. Moving forward to the face, patient's face and facial symmetry seems appropriate. No unsymmetrical or abnormalities or deformities noted. Would it be all right if I did a palpation of your face? Okay, so I'm going to palpate the patient's face, obviously being respectful. Just palpating the hair, looking for any kind of bumps, bruises, lumps, abnormalities. The patient's scalp, hair, and cranium appear to be all within normal limits, nothing abnormal noted. So a few extra things. Could you clench your teeth? Okay. Could you stick out your tongue? Okay. So those are both appropriate and within normal limits. At this point, I'm going to palpate your sinuses, and I want you to tell me whether or not you're experiencing any pain. Okay. Any pain? Okay. So no pain and within normal limits. I'm just going to inspect kind of the external structures of the patient's face, including the brows, her lips, her lashes. Nothing really abnormal besides maybe a little dryness of the lips, a little bit of lip balm will take care of that. So I'm going to move forward to the eyes, just kind of at a glance. No, everything looks within normal limits. I'm just going to do a quick inspection of your eyelids, if that's all right, expecting the conjunctiva. Pink, no discoloration or anything noted like that. At this point, I'm going to move on to a focused eye assessment. So what I'm going to do is I have a light here, and I'm just going to ask you to look straight at me, and I'm going to shine a bright light in your eye, okay? So we're going to move from one field of vision inwards. Excellent. Okay, so pupils are equal and reactive to light. One other thing I'm going to do is I'm going to ask you to just look at this light. Keep your eyes, your face straight ahead, but look at this light with your eyes, okay? So at this point, we're testing the 6 cardinal positions. So follow this with your eyes. Okay, so EOMs, corneal light reflex, 6 cardinal positions of gaze, all within normal limits, no abnormalities detected. And at this point, I'm going to assess near vision. Looking for my little paper with the notes on it. Here it is. Okay. So this is to test your near vision and whether or not there's any abnormalities there. So what I need you to do is cover one of your eyes. Read this top line.
The northern countries of Europe.
Okay, now cover your other eye. Read this bottom line.
They seem to be.
Okay, so she read both lines appropriately. There seem to be no issues with her near vision. So at this point, we're going to move to inspection of the ears. Could you pull your hair back for me, ma'am? Okay, so I'm just going to externally inspect the ears. Making note of any issues or abnormalities. Just from inspection, there seem to be no problems. I'm going to move on to palpation of the auricle and the tragus. Is there any pain when I'm palpating? Okay, no pain noted. on the left or the right. Is that correct? Okay. So I'm going to move on to an inspection of the external nose. Nose seems to be centered midline of the face. No abnormalities or deformities noted. Also, I'm going to test patency of your new nose, so I'm going to cover one of your nostrils and just ask you to blow out the other one. Blow hard. Okay. Okay, both nostrils appear to be patent. Moving forward, I'm going to do an inspection of the mouth, lips, and inner mouth. So could you say ah for me? Okay, I'm going to get my light here. Sorry, ma'am, could you say ah? Okay. Tonsils appear to be healthy within normal limits. Normal movement of the uvula, it's midline, so all that appears to be normal. Then move on to an inspection of the neck. On the first glance, there's no abnormalities noted, nothing of note there. At this point, we're going to move on to a range of motion test for the neck. So, ma'am, could you move your head to the side? Now the other side. Now move your head back, looking at the sky. Now looking at the floor. Okay, look straight ahead. I'm going to put my hand on your face and then press against my arm. Okay, perfect. Other side. Okay, now I'm going to be testing your shoulder strength. Can you move your shoulders up towards the sky? Press against me. Okay. So shoulders and neck seem to have proper range of motion and good strength. At this point, I'm going to palpate any lymph nodes and check for any swelling. So I'm just going to be palpating you here. Okay, no signs of any swelling or masses on the lymph nodes, so that's within normal limits. At this point, I'm going to palpate your pulse, if that's okay. So we'll palpate the carotid pulse on the right side. Present and strong. Present and strong on the right side. Left side as well, I would say maybe a +1 or 2. At this point, we're going to move on to an inspection of your posterior chest. So if I could ask you to just spin around for me, move your hair to your front if you could, that way I can make an inspection here. I'm going to be using my stethoscope soon, so I'm going to get that ready. But what I'm going to start by doing is just a visual inspection. Just breathe normally, ma'am. There appear to be no signs of deformity or respiratory distress right off the bat. We're going to move forward, and I'm going to do a palpation for chest wall expansion. So I'm going to put my arms on your back, if that's okay.
Yep.
And I just want you to take a deep breath, several deep breaths. Just breathe normally, deep breaths. Okay, I'm feeling appropriate chest expansion. Everything seems to be within normal limits. You can breathe normally. So next of what I'm going to do is a technique called tactile fremitus. Every time I put my hand on your back, I want you to say the words 99. Is that clear?
Yes.
Okay.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay. So that's appropriate and within normal limits. Next thing I'm going to do is percussion of the lung fields. Tell me if there's any pain that you're experiencing right now. Also, I'm just assessing for any resonance or abnormalities noted. Okay, that all seems to be within normal limits. The next thing I'm going to do, ma'am, is I'm going to give you almost like a light tap on your kidney, and I want you to tell me if there's any pain. Okay, we're assessing for any issues back here of flank pain. So you tell me if there's any pain.
No.
Okay, so that's within normal limits as well. So I'm going to move on to auscultation and begin to assess breath sounds. Every time I touch you with my stethoscope, if you could take a deep breath for me. Perfect. Now if you could do me a favor, spin back around, face me. Assess the anterior breath sounds at this point. Thank you very much. At this point, I'm just going to move on to a visual inspection of the precordium. So, right off the bat, there's no abnormalities noted, no deformities, nothing visually that's going to throw us off. At this point, I'm going to palpate, ma'am, if that's all right with you, find the apical pulse and point of maximal impact, which would be mid-clavicular line, 5th intercostal space. So, pull it palpate here. Okay, right about there. Okay. So right now, while I'm palpating and finding the pulse, I'm palpating for any thrills or heaves that are noted. I'm not noting any abnormalities. I'm going to move on to auscultation of heart sounds. And I'm going to count the heart rate at the point of maximal impact with the apical pulse. Okay, heart rate is approximately 75 beats per minute. No murmurs or abnormal arrhythmias or irregular heart rhythms noted at this time. At this point, I'm going to help listen again, but with the bell of the stethoscope. So again, no abnormalities noted. We're going to move on to inspection of the hands, arms, and shoulders. So ma'am, I'm just going to do visual inspection. Again, like we noted with the skin assessment, there don't seem to be any issues, any scratches, other than some very superficial scratches. What I'm going to do is ask you to hold your palms out like this. I'm going to assess your pulses, both radial pulses. Both pulses are regular and present. I'm going to assess for capillary refill. Okay, good capillary refill, less than 3 seconds. And at this point, ma'am, I'm going to assess your range of motion in your shoulders. So I'm going to ask you to hold your arms out straight like this. Now bring them up to the side and back down. Okay, proper range of motion in arms and shoulders. No really abnormalities noted in the upper extremities. At this point, ma'am, can I ask you to climb onto our exam table? And I do mean climb. So we're going to start with auscultation of the abdomen. Start with inspection of the abdomen. So right off the bat, just with visual inspection, there seem to be no abnormalities or deformities. And then we're going to move on to auscultation. I'm starting in the right lower quadrant. Okay, bowel sounds present in all 4 quadrants. We're going to move on to percussion. If this hurts at any point, please let me know. Percuss all 4 quadrants. No pain noted? Okay, I'm going to move on to some light palpation. And let me know if you're experiencing any discomfort or pain. Any pain? Okay. And do some deeper palpation. Okay. While I was auscultating, I neglected to auscultate for the abdominal aorta, so I'm going to do that right now. No bruits or abnormalities noted. I'm going to move on to the legs. So I'm just going to do a visual inspection of your legs here. There seem to be no real abnormalities or scratches, maybe a couple scratches or 2, but that's pretty typical, nothing out of really the ordinary. I'm going to inspect, continue to inspect down here. I'm going to inspect for pulses. So I'm going to feel for the pulses here. What I'm feeling for is posterior tibia pulses and the dorsalis pubis pulse. Okay, both are present in the right foot. Yes, both are present in the left as well. So, ma'am, what I'm going to do next is I'm going to do a range of motion check on your leg and your hips, okay? So what I'm going to ask you to do is just lift your leg up like this, yep, and bend your knee. And then I'm going to adduct your hip and abduct your hip. I'm going to move your hip to the side and back. You tell me if there's any pain. No. No pain noted in the right leg. We're going to do the same on this side. Any pain?
No.
Okay. So no pain noted. Good range of motion on both legs. That's going to conclude our inspection of the legs. Ma'am, if you could hop back over to here. I'm making you move around a lot. Okay, so next what I'm going to do is a neuro check. I need you to close your eyes. I'm going to touch you with a cotton ball in various body parts. I need you to tell me where I'm touching you. Okay?
Right cheek. Left cheek. Left arm. Right arm. Right hand. Left hand. Left leg. Right leg. Left shin. Right shin. Left foot. Right foot.
Okay, so good sensation present in both upper and lower extremities bilaterally. The next thing we're going to do is test your cerebellar function. So hold your hands out like this. I'm going to ask you to supinate and pronate your hands like this and do it real fast. Okay. So nothing unnoteworthy there. Everything seems to be, again, within normal limits. The next thing I need you to do is take your heel, put it on your shin, and run it down your leg. On your shin. Yep. Okay, now the other leg. Okay, proper motor control noted. Perfect. Okay, now just sit back down. What I'm going to be doing now is testing the tendon reflex in your bicep and various other body parts. So let me see your arm here. I don't have a bell, the proper instrument. I'm using something here, but I think it does the same function. What you need to do is relax your arm here. And I'm just going to feel for your tendon here. Okay. So some reflex noted there within normal limits. Okay, again noted. We're going to move on to the patellar. Okay, slight movement noted there, other leg. Again, slight movement noted. Move on to the Achilles reflex. I want you to relax your foot. I'm going to bend it up. Okay, slight movement noted. It's kind of hard to see with the camera, but there is some slight movement. Okay. Again, same. So now I'm going to Move on to the plantar reflex. I'm going to slightly brush the bottom of your foot here. Yeah, you fell down. Yep, it kind of tickles. It's a little bit uncomfortable. Okay, so that is our reflexes. Now, ma'am, I just want you to stand up. And what I need you to do for now is to walk over to the window over there. Okay, you can stop right there. I noted the gait. Patient has a proper gait, no abnormalities noted. I need you to walk back to me by doing heel toe. Perfect. Okay, proper gait, proper balance noted. One more thing we're going to do is called the Romberg test. Rather, ma'am. So can you stand right here facing the camera? What I'm going to ask you to do is to stand with your feet close together at first, arms at your side. Now bring your arms out like this and lift one leg up, closing your eyes. Okay. So patient is displaying proper balance, nothing outside the ordinary there, so all again within normal limits. The last thing we're going to do is assess the range of motion in your spine. So what I ask you to do is bend down to the floor. Okay, that's fine. Excellent range of motion. Now bend your back towards the ceiling. Okay, now side to side. Okay, and then twist. Excellent range of motion. That concludes our full head to toe assessment. Thank you very much, ma'am.